It's very common for people with TMJ dysfunction to also experience some type of ear symptoms. The most common are ringing, fullness, pressure, and pain. But just because the ear symptoms happen around the same time as the jaw symptoms, it doesn't mean there's a causal relationship here. This is actually a logical fallacy called the false cause fallacy. You may have heard the expression, correlation does not equal causation. This fallacy is responsible for almost all superstitions and old wives' tales about getting sick. My grandparents and those who came before them used to believe that going out in the cold causes people to catch a cold. Now, I live here in Buffalo and it gets pretty cold here in the winter, so that makes it pretty easy to prove this particular old wives' tale wrong. And as it turns out, deliberate and controlled exposure to cold can have significant benefits when it comes to your immune system and your body's defense against illness. So not only is that particular old wives' tale false, it's actually counterproductive and maybe even deliberately misleading. So when I hear and read all the anecdotal and unsubstantiated claims about how TMJ causes ear pain and ringing and fullness and even things like dizziness and vertigo, my BS antennas go up pretty quickly. And I can tell you that in my 25 years of experience as a dentist, the last 11 of which have been exclusively concentrated in the diagnosis and treatment of TMJ dysfunction, I rarely see a direct connection between ear symptoms and the TMJ. But there are a couple easy things you could do in order to determine whether or not your particular ear symptoms are related to the function or dysfunction of your jaw. First, write down your ear symptoms and be as specific as possible. It's important that you describe clearly what you're feeling, when you're feeling it, and whether or not you've found anything that increases or decreases the intensity of the symptoms. Second, have an ear evaluation by an ear, nose, and throat specialist. Don't just go to your regular doctor and ask them if there's something wrong with your ears. Chances are they're just going to put you on antibiotics or a steroid without really doing any real diagnostic investigation. You need to go see a specialist who deals with ear symptoms every day. And if you do find out that there's nothing detectably wrong with your ear structures or your nasal passages, the sinuses or the eustachian tubes, then you can more confidently assume that your particular symptoms don't originate from within these structures. Number 3, push on your jaw joints with your finger and see if it hurts. So first push on the lateral pole of the condyle of the jaw, and you can find that by putting your finger right in front of your ear and moving your jaw up and down a little bit. You don't have to push very hard with your finger in order to determine whether or not there's inflammation. If there's inflammation, you're going to feel it even with light pressure. The second place I want you to push on is just behind the condyle. So when you open a little, you'll feel a depression open up, a soft spot behind the condyle right in front of the ear. If you palpate this area behind that condyle, what you're palpating is the ligament, the sling ligament called the TMJ ligament, temporomandibular ligament, that holds that condyle against the eminence, the articular eminence of the temporal bone. In other words, this is the ligament that holds the jaw condyle in the socket and keeps it stable. If that ligament is stretched or sprained, it should be a little bit sore. And again, you don't have to push very hard for this. Now, the third place I want you to push on is inside the ear, which is the front wall of the what's called the external auditory meatus or auditory canal, is the posterior wall of the temporomandibular joint. So when you put your finger in your ear and push forward this way and a little bit inward medially, you'll be able to feel, as you move up and down, you'll be able to feel the back of that condyle moving back and forth. Again, if this area is sore, even with light pressure, then you probably have a little bit of inflammation there. If you do feel like there's soreness or inflammation in any of these areas, again, write it down. And then repeat the process and notice if, when you push on these painful areas, it changes the quality or intensity of the ear symptoms. If it does, then there's a good chance the two are connected, and pursuing a TMJ evaluation is probably a good idea. The third thing you can do is to move your jaw through its entire range of motion and notice if any of these movements changes the quality or intensity of your ear symptoms. So remember, the jaw has 3 directions of movement. It can open and close, it can go side to side, and it can go forward and back. So open wide and close. And then move your jaw side to side. And then move your jaw forward and back. If any of these movements changes your symptoms, then there's a good chance there's a connection, and again, a comprehensive TMJ evaluation would be a good idea. And the fifth and final thing you can do to determine whether or not your ear symptoms are actually coming from something within your jaw is to squeeze your teeth together as hard as you can and see if you notice a change. Sometimes ringing in the ears in particular will intensify when people clench their jaws. If this is the case for you, then there may be a relationship between your ear symptoms and your jaw, and having a full TMJ evaluation to determine the appropriate course of therapy is probably a really good idea. So I hope that understanding and implementing these 5 steps can help a lot of people determine for themselves whether or not there's a connection between their TMJs and their ear symptoms. And if you do discover that you have some form of TMJ dysfunction and you'd like to rehabilitate those compromised structures, check out my new TMJ Rehab app, which should launch in the next couple weeks on the App Store and the Google Play Store. This app outlines my 12-week program of functional TMJ rehabilitation, where I'll demonstrate all the steps in the process we go through with our patients here at Buffalo TMJ. I'm Dr. Jeff Dolgus. Thanks for watching.